So hello, everyone. We are so grateful to have you all joining us today for the first of two medical webinars that we are going to be hosting this month. Today, we're going to be delving into the life stages of companion parrots. Our panelists and speakers today are two incredible veterinarians that many of you are probably very familiar with already. So joining us this afternoon, we have Dr. Brenna Fitzgerald of Colorado Exotic Animal Hospital, as well as Dr. Anthony Pilny of Arizona Exotic Animal Hospital. Yay, thank you guys for joining us today. And then before we jump into our presentation today, we have just a few housekeeping notes. So first one of those is we are going to be recording this webinar. So if at any point you need to hop out or you would like to review any of the topics that we cover today, this is going to be posted on our YouTube channel, which will be linked on our website. And then we'll also send out a link for viewing as well. And then our other note, we do have our Q&A open, so you can submit questions as we're going. To make the most of our time together, we do ask that you keep your questions more general and focused on today's topic, so everyone that's participating can benefit from that feedback. So for any personalized medical advice about your bird, a veterinary appointment or consultation would be the best option there. And then so we're going to be doing the Q&A kind of at the end of the presentation. And if there are any questions that we don't get to today, as far as discussion, we will be collecting those and sending those off to our two speakers today. So they'll have the chance to answer those after the presentation, and then we'll send those responses in an email blast so people can read all of those. Perfect. So with those things out of the way, we are super excited to pass it off. Thank you again for joining us today. And if you wouldn't mind introducing yourselves and sharing a little bit about what you specialize in, we can go ahead and get started.
Absolutely. So my name is Brenna Fitzgerald. I am an associate veterinarian at Colorado Exotic Animal Hospital in Denver. The practice opened in August of 2022. So we just celebrated our third year, and we have added to our veterinary staff, and I think have a really awesome overall staff as well. But Colorado Exotic Animal Hospital is part of a group of clinics that's still all privately owned, and 3 locations in Arizona. And Dr. Pilny practices there. So he's kind of on the Arizona side, and I'm on the Colorado side. I have been seeing birds exclusively for most of my time as a veterinarian, for about the last 18 years, done birds exclusively. And so my colleagues and Dr. Pilny and the practitioners at the Arizona hospitals are even more diversified than I am. And I understand, see a number of exotic species. But Dr. Pilny, I know that you're avian boarded as well, but you see all kinds of exotics.
Right. Thanks again for inviting me to participate in this webinar. I think, as we all realize, education is hugely important, and there's always so much we can learn, and there's always a lot to share and discuss, with a primary focus on pet bird welfare. But yes, I was fortunate to have completed an internship and a residency in avian and exotic pet medicine. And like Dr. Fitzgerald, I am board certified avian specialist. I have been a veterinarian, and it's shocking when I say this, 24 years. 23 of those years I've dedicated to bird and exotic pet practice. So birds are a big part of my caseload, but I do see and treat all of the other pets other than dogs and cats at our practices. The Arizona hospitals, we have 3 locations. I work mainly out of 2 of them. And I'm just really glad to be part of this and help support Dr. Fitzgerald, sharing this important information with you all. So thank you for attending and giving up some of your time to learn and grow and be better bird parents and keepers.
Are we all ready to hop in for presentation?
Yeah, yes, I'm going to start sharing my screen for everyone now. Get into presentation mode here. Okay, very good. You can do it. There we go. Okay. Um, so we are going to be speaking to you guys for about an hour, and then we have time for questions afterwards. Certainly it's a big topic to try to go, well, let's cover everything pertinent to each life stage of a parrot's life. Kind of hard to cover in an hour. So we're gonna focus on some specific aspects and things that pertain to each life stage as far as youngsters through to adulthood and middle age and upwards of to geriatric older guys. So our main focuses for today, we want to touch on some nutritional basics. Certainly it's beyond the scope of today's presentation to go into major detail about nutrition. I think we could spend an entire life stage talk just about the nutritional aspects of each stage of life. But we have lots of other things we want to talk about today as well. So we're going to just be lightly touching on some nutritional considerations relevant to different stages of life. And we're also going to be touching on welfare and enrichment. There's a lot of wonderful resources out there, including just a recent webinar from the Gabriel Foundation about enrichment. So we don't want to necessarily reinvent the wheel on that, but we do want to hit a couple of the high points as far as welfare considerations in these guys to set them up for all their entire lives, and enrichment that is going to greatly improve their welfare over the long term. We're also going to talk quite a bit about common diseases and conditions by age group, and that will be the main thrust of our presentation today. So just a few nutritional things, just briefly touching on. I would say, you know, some folks are starting out with their pet bird as still unweaned. In some states that is legal to sell unweaned birds. In some states it is not. And even in states that it is legal, or illegal, it still occurs. It is legal in Colorado, so I do see some folks that maybe have gotten a new bird for the very first time and they've started with an unweaned baby, which is probably not ideal. And of course, I'm a big proponent of adopting adult and older birds, which is some of the amazing work that the Gabriel Foundation does along those lines. Dr. Pilny, is it legal for stores to sell them unweaned in Arizona? Is that something that you run into?
Yes, it is legal. And if I'm not mistaken, I still think California is the only state that has made it illegal to sell
Okay.
unweaned baby birds, which means,
Yeah.
as a welfare topic, people who have never owned a bird are now getting a baby that's completely reliant on them and completely
Yeah.
relying on that care with very little training. But if I'm not
Yeah.
mistaken, California is the only state that does not allow it. But like you said, it still happens.
Yeah, and that's where my perspective comes from, just because I practiced in California at the Medical Center for Birds for a long time. And so, but I would still sometimes see birds that are sold unweaned. So, it's certainly not in our purview today to, teach hand feeding guidelines, other than to just very briefly speak to, high quality diets are really important. There's a lot of great commercial diets available. It's very important that appropriate temperatures are used, but there's going to be a lot of variability in the volume that is fed per feeding, how frequently feeding is done, based on the species and the age that hand feeding begins. And it's when I see problems in practice, it often has to do with them being underfed, um, or inappropriate temperatures, too hot, too cold, things like that. And so some of the diseases we see in pediatrics are related to those kinds of problems, which again is more of an issue when it's folks are inexperienced with it. But one of the more common issues is being underfed and being stunted and not, hitting appropriate weight milestones. And so keeping weight logs is a really important part of successfully hand feeding birds. But, so that's how a person, for good or for ill, may start with their pet parrot. It's still being hand raised. So the weaning process is something we're going to speak a little bit about, and also some general feeding recommendations as birds start to mature and become juveniles and young adults. But because a lot of that is beyond the scope of our talk today, I just wanted to point out some of the wonderful resources that exist. The Gabriel Foundation's own Beyond Bird Basics classes cover a lot of these topics, including foraging and enrichment topics as well. The Association of Avian Veterinarians has some wonderful handouts available to the public on this website, including instructions on how to wean baby birds, how to convert from seed-based diets to formulated diets, and also topics of foraging and enrichment as well.
And remember, weaning is a unique process to the individual. And I think that's one of the important things that novices don't realize. It has to be tailored to that individual bird. When they're trying to set these exact rules, like it must be weaned by 7 weeks old, or it should be doing this, or it should be eating, people have to understand to abandon some of those rules and really focus on the individual baby they're raising.
Yeah, exactly. And as is indicated on this slide, the weaning process, is probably easier for birds who have siblings that they're weaning with. And that may not be the case if someone purchases an unweaned bird and basically takes it away from its siblings, and now it's kind of on its own. And they may have, not a ton of experience. But yeah, that's absolutely right. And kind of forcing weaning, expecting them to fit a certain timetable can be really problematic. Something that I also see in practice a fair bit is folks that have purchased a pet bird that was just recently weaned by the store or is thought to be weaned. And then they take it home. It has to adjust to a new environment, a new family, and it's not uncommon for them to regress and almost fall back and need some hand feeding again. So I've definitely known some birds that maybe they were weaned supposedly at the store for at least a couple of weeks before they were sold, but now they're taking a step back, and I actually have to counsel folks on returning to some hand feeding. But yeah, generally it's a gradual process, and it has to happen in a bird's own time. It shouldn't be forced. And there are definitely species differences. Generally, your smaller species are going to wean younger and kind of develop faster than your larger species. It's reasonable to expect some weight loss during the weaning process, but we don't really want that to exceed 10 to 15%. And again, that's where keeping a weight log is very important. And it's important that they are adequately fed. If we are trying to push it and they're hungry, they may feel kind of desperate and frustrated and not comfortable focusing on exploring foods. They're just so focused on how hungry they are and asking to be fed. So keeping them sufficiently fed during the weaning process is important. And you start introducing foods before they're really ready to eat on their own. It's just so that it's in their environment. It's something they can explore and touch and taste. And starting with things that can be broken up into small pieces, and also softened foods, including softened formulated pellets, is a good place to start. And then you kind of start diversifying that over time. Their natural curiosity kicks in exploring these items. And also if there's mature birds already in the flock, that just observing them eating and modeling can help these guys, and even us modeling and making eating even our own foods with them a social event is helpful. And then we're going to gradually reduce the feedings, usually starting at the midday feeding, and then moving to the morning feeding, or doing the morning feeding later. And then usually the last one to go is the evening feeding. And again, we let them take it at their own pace. They will tell us by starting to refuse or kind of lose interest, that they're ready to not take as much formula. So general parrot feeding recommendations. I would say most parrot species these things apply to, but there are most certainly exceptions, and which I'll touch on a little bit. And there's also lots of differences of opinion about how birds should be fed. And you're going to find resources with varying information. I think that can be challenging for people to understand, you know, like, well, what's the right answer? For most parrot species, we tend to focus on a predominance of a formulated a diet or a pellet. There are many brands and varieties on the market, most of which I feel are pretty good quality. Some I tend to gravitate more toward. I think, for example, Missouri, Lefever's, Rowdy Bush, Supreme, Harrison's bird diets are kind of my go-tos. But there are others on the market as well. And again, your average bird, we'll talk about the exceptions in a minute, but fruits and vegetables, and really more of a predominance of vegetables. You know, I'm kind of trying to go for my lean and nutritious veggies rather than things that are more sweet or starchy, like our corn or potatoes, and focusing on vegetables more than fruit as far as having better nutritional value. But that kind of comprises most of the rest of the diet, and we keep our seeds and nuts maybe closer to 10% of the total diet, and supplementing too with legumes. The Gabriel Foundation has a great recipe for mash that incorporates a number of different grains and legumes. There are also some diets out there like Bird Street Bistro that incorporate maybe pastas, things like that. I try to keep those things more minimal because I think it brings in a lot of extraneous calories and sometimes too many. Egg is something, and other table foods, human foods, people do feed. I try to keep that to a minimum as well. Some of that pertains to cardiovascular disease, which we'll get to later. And if I am going to feed egg, I might use like egg white and less likely to want to use the higher cholesterol egg yolk. Generally, if you're feeding a formulated diet as part of the diet, additional supplementation isn't usually needed, which is one of the benefits of formulated diets. But if birds are maybe on a higher seed diet, and for some species that's appropriate, you know, it's fair to consider maybe a calcium supplement, something as simple as a cuttle bone for some of our smaller cetaceans. And vitamin and mineral supplements do exist that I think can be appropriate, especially maybe when you're working on improving the nutritional plane of a bird you've just adopted that has been eating peanuts for 20 years and you're working on diet change, but in the short term, a vitamin and mineral supplement might be a helpful stopgap. So there's a lot of species differences. I have a couple of pictures here of an eclectus and a lory. These guys are kind of unique and different. In general, I'm going to be a proponent of for eckies, 50% or more, maybe upwards of 70% of the diet being like a veggie chop, and formulated diets less, quite a bit of a minority. I might have pellets be 10% of the diet or so. And I tend to not supplement these guys. We tend to see issues with like toe tapping and wing flipping that seem to be associated with over supplementation. But those guys really do great with basically a lot of roughage and not as much pellet seeds, things like that. Our lories are kind of even more specialized, and there are good commercial diets, lory powders and nectars that tend to be a large part of the diet. For hyacinth macaws, we know that they tend to eat a lot of palm nuts in the wild, and so higher fat content in the diet and a lot more nuts in the diet tend to be more appropriate for them. They would not be one where nuts would comprise a great minority or like 10% of the diet. In my personal opinion, I don't know how you feel about this, Dr. Pilny, but I feel that our small cetacean species that tend to be like ground foragers with seeds, so our budgies, our cockatiels, but also birds like parrotlets, lovebirds. I feel that they do best when they have relatively more seed in their diet, and maybe upwards of 50% of the diet comprised of seeds. I've known a number of individuals that when they're put exclusively or mostly on a formulated diet, that they don't seem to digest it as well, that they have some motility problems, that the crop doesn't empty out very well. It's almost like they need that seed to have the gut moving and working the way it's supposed to. Has that been your experience, or do you feel differently about that?
No, I would agree. And I think we recognize that in certain subspecies of birds as well. And I think for me personally, I think we still continue to over demonize seeds in
Yeah,
feeding our pet birds. And I know historically, 25, 30 years ago, yes, the seed diets were garbage. And I think that they have really stepped up and we know a lot more about, nutritional supplementation. We know more about vitamins, and there are some high quality seed mixes and seed diets that can be absolutely part of a balanced diet. They provide some enrichment. So I think seed
yeah,
diets, though we still recommend them being the minimum, there are some birds. I mean, when exactly what you're talking about, when we look at the wild type diet of those birds that are granivores, we have birds that are frugivores that eat mostly fruit. We have birds that eat different natural diets. You mentioned hyacinths eating a super high fat diet when they feed on palm nuts for months at a time. So we really should look at the wild type diets, but I
yes.
think that we need to think, and the key thing I tell people is the word variety. Think about variety when you're feeding, and I think that's the best way to do it. A variety of pelleted diets, a variety of the highest quality seeds and seed diets, variety of fruits and vegetables. Just don't oversimplify it. Keep that variety in there to meet their nutritional needs. So,
Agreed. So we're going to go through welfare and enrichment rather quickly to make sure we have enough time to cover our diseases by age group. Um, but something I wanted to point out is, what sets up a bird for success in their life as far as having the best emotional and mental well-being. We want to foster their natural inclination toward curiosity. We want them to be, to some degree, independent and self-reliant, and not entirely just melded to us and looking to us all the time for stimulation. Um, and this allows us to grow their cognitive abilities and improve their emotional stability. And a big part of that as well, in my opinion anyway, is allowing them the opportunity for flight, because it basically not only improves their physical health, developing good, strong muscles, and maintaining better cardiovascular health throughout their lives, respiratory health as well. But it fosters that curiosity, that need for independence, and self-sufficiency, and being able to forage far and wide and not just in the kind of confines of the cage, be able to explore their environment. It really allows them to build confidence. I think that birds that are not allowed to fledge and learn to fly naturally as youngsters are really hamstrung, so to speak. I think that they have a lot less they have a lot less independence and confidence, and sometimes straight up emotional problems related to having been clipped from the very outset and perhaps being clipped inappropriately. Um, so certainly there are instances in which wing trimming is appropriate. I think the rule of thumb should be it is considered on an individual basis. What are the circumstances in the home? What are the risks of this bird being fully flighted? And are there any individual needs that that bird has that might make a wing trim appropriate? We use it in part for control. They have less choice. We take that choice away to a degree by trimming. And our intentions generally are good. They're intended to try to keep them safe. They're easier to also get back in their cage when you need to. Or, people have this idea that you can walk outside with them on your shoulder as long as they're trimmed, which isn't really accurate. There's still a lot of risks there and dangers, but we're trying to keep them safe. And to some degree, we're trying to control them. We may be trying to do training, and if they're just flying away, we're not, able to make much headway with that. So, but I think that keeping birds trimmed and especially preventing them from fledging and learning to fly as youngsters, I think is a mistake. I think it does create kind of a learned helplessness situation. They're almost more dependent on us. We take away their opportunity for self-reliance and independence. Um, and I think Dr. Pilny, you're kind of in agreement along those lines, right?
Yeah, wing trimming has become a huge welfare issue in pet birds. And I've actually had the opportunity to speak about that topic at some conferences in the last few years. And I think there's been a huge sort of awareness of sort of what historically we've done. The norm has always been wing trimming. It was the wing beak
Yeah.
nails when you went to the vet.
Yeah.
The annual checkup included a wing trim and a beak trim. We know birds shouldn't have their beaks trimmed unless they need it for medical reasons, but just the same, there's been a big push to really focus on flight and the importance of it. And it's something that we as veterinarians need to counsel each person. Every client that comes in and asks for a wing trim, I follow up with why. Do we have
Me
to?
too.
Why can't the bird fly? Can you create a safe environment? Can
Yeah.
we think about promoting that flight? Of course, for safety reasons, we have no choice, but it is definitely something we need to pay attention to, and we need to be advocates for flight as much as possible.
Yeah, I think not only can we see a lot more injuries with trim wings, and most importantly, inappropriate wing trims, overly excessive wing trims or techniques that really are not best to allow safe landings. And so the kinds of injuries we see, certainly broken blood feathers, when let's say a number of the feathers are trimmed and then one of them begins to grow back in, and there aren't any others next to it to support and bolster it, as to be more likely to be broken, falling hard and chipping their beak tip off. Piga style injuries refers to when they kind of land on their butt and you can have the skin split kind of near the vent. And then also the same thing can happen over the keel as well. But also just not having the opportunity for exercise. We're coming to understand that there are a lot of health problems, just like people, a lot of health problems that stem from a lack of exercise throughout their life. And I have seen a lot of psychological harm in birds that are trimmed from the outset. They're never allowed to learn to fly. They're trimmed incorrectly from the outset, and they're literally set up for years, if not a lifetime, of repeated falls. What I have seen is that it causes a lot of learned fear and sometimes generalized fear. They know that if they lose their footing, if something startles them, they're going to fall and it's going to hurt. And over time, it almost becomes a self-fulfilling prophecy where they'll almost like psych themselves out and panic and then fall and then go, see, I knew I was going to fall. I knew I was going to fall. I did, and it hurt. And so a loss of confidence and just a lot of generalized fear. Yeah, I think that the best wing trim is the one that we consider isn't even appropriate. But there is an alternative technique in wing trimming that Dr. Driggers, who has a hospital of his own in Arizona, came up with, the so-called skinny trim. And the intention here is to mitigate control flight. I mean, that's the whole point of a wing trim, but to allow kind of a soft, smooth landing. Almost like they can still fly in the sense that they can still go through that same motion, those same motions, but it's just kind of a little bit less efficient flight, if you will. So I think it's a better way of basically limiting flight, but kind of not trying to take it away. So a little bit on foraging and enrichment. Again, there's a lot of resources on this that you guys can access. But in short, there's a lot of these behaviors kind of do come naturally, but there's also a lot of different things that and tasks and skills that need to be taught, and that's part of the way that we can interact socially with our birds is by teaching them these things. So there are some simple ways of providing foraging that don't require a whole lot of teaching, that you have more of a variety of sizes of things and bigger pellets or food items that have to be broken up. Also, you know, I have had some success getting birds to start eating veggies if I or encouraging them to eat them more if I make kind of fun shapes with them. Something I like to do is use a carrot peeler to make strips of whatever kind of veggie it is, because they find the edges kind of interesting to nibble on. And the same is true for like leafy greens like cilantro that have a fun textured edge to the leaf that they might want to explore and play with. Um, and then also they don't have to just have one bowl. We want to get away from that. We want them to have multiple different stations and places that they know that they can go to within the cage and also in the larger environment and access food in different places, just as they would in the wild. And other things that I think, other strategies that I think work really great are these kind of foraging boxes or foraging mats, which take lots of different forms. Foraging baskets that are basically filled with lots of random other materials that might also be of interest and sensory stimulation to the bird to chew on and play with and throw around and things like that. And we have food hidden in and amongst all that material. And it's with the grass mats, it's really great for our ground foraging birds in the wild. And there's many, many ways to do this, you know, poking holes in pieces of cardboard and putting little treats inside of that. I really like doing like a toilet paper roll, like a roll of toilet paper with the toilet paper still on it, which makes a huge mess. But then sticking things in the layers of the paper so that they, as they buzzsaw through the toilet paper roll, they find things. So those are just a few examples. There are also a lot of products on the market that are designed for foraging. I think there's more stuff available now than ever before. And some of those are actual puzzle toys that are a little bit more complex and require more teaching and very much stepwise teaching, so that they can learn to do a more complex task. But just being able to roam around in the room, and maybe there's a high shelf where there's a bowl up there or some things scattered and they go from one station to another and access different locations. Using the existing bowls, teaching them to pop through paper on a covered bowl, so that your existing bowls can be your foraging item. And then of course I really like to do, you know, teach them again step by step, working one-on-one, showing them and teaching, but wrapping a favorite food item in maybe one layer of paper. And then over time, I build layers of complexity, and that goes in another piece of paper, and then that goes in a coffee filter, and then that gets wadded up and stuffed into a toilet paper roll, and then that gets put into a little box, and then you just build from there. So I repurpose a lot of packaging, like, you know, oh, some face cream came in this little box and I can use that for foraging. But there's also a lot of things like that sold for that purpose as well. A lot of people get concerned about safety of these kinds of materials. And it's true. Could they get wrapped in it? Could it wrap around their foot or their neck? Could it be something that they eat or ingest or even be toxic? The thing is that life is dangerous, right? We can't have them living in a glass case and not touching anything. Would it be safe? Yes. Would it be a good way to live? No. So what I tend to do is observe how they interact with various materials and get an idea of, do I think that they're actually ingesting that? Is it disappearing? Do I see it just falling out of their mouth? Because every bird is different on how they're going to interact with materials. So we want to be vigilant, we want to pay attention, but we also don't want to be so paranoid that we don't offer adequate enrichment amid fear that something bad will happen. So we're going to jump now into common conditions of youngsters. So in general terms, I would describe diseases of young birds as being the things that tend to happen to you when you're young and dumb, basically. And it isn't to say that any of these conditions couldn't affect middle age or older birds. They absolutely can. But there are certain issues that I feel like are especially common in birds that basically don't have a lot of experience in life. And they're doing dumb stuff and they're, you know, living and learning kind of thing. So there are a lot of different problems that we see in pediatric patients in particular that we don't have time to go into detail on all of them by any means. the ones we're going to focus on the most, again, this is the things that you do when you're young and inexperienced category. Eating things you shouldn't is one of those things. So foreign bodies, certain things that they may ingest can be toxic. And also we might be more apt to see trauma, especially if they're predisposed to it with, let's say, an inappropriate wing trim when they're younger. Not to say that an older bird couldn't have an accident as well, but I feel like we especially see silly stuff happen to these guys when they're youngsters. I don't think, Dr. Pilny, that we really have time to elaborate on this list, but just wanted to give you an idea of kind of the spectrum of things we can see in pediatrics, especially in when people maybe don't have the experience they should in hand rearing birds. Or are there any of these items that you feel would be good to expound on, that you'd like to expound on before we move on, or no?
Well, I think it's like we said, in the interest of time, we recognize these lists and we know what we describe as common diseases of young birds, the same way we talk about diseases of older birds, older pets, older people. We recognize things that happen. And we largely think that babies are probably more susceptible to infections than older birds with a more competent immune system.
Yeah.
We think birds, adult birds are more skilled at climbing, flying, less likely to have trauma. So, we kind of go through it. I mean, any one of these topics could be a whole webinar, if we
Yeah.
wanted to. So in the interest of time, I think it's smart to focus on a few that are much more commonly seen. Some of them are pretty self-explanatory just from the title. Some of them are a result of captive care issues, but I think it's good to just focus on the ones we see more often.
Yeah, so we're going to talk about some trauma issues next. Um, and so a lot of different things can happen in the home. Certainly we hear about birds flying into something, so a wall or a window. I have seen in a lot of cases where the bird's flying around and someone closes a cabinet or a door at that time, and the bird gets partly stuck or hit as the cabinet closes. Ceiling fans, as we all know, can be a hazard, and for that matter, not on this list, but also like, open boiling pots of water in the kitchen, and a stove that's on, and an open toilet lid, and things like that. We see, unfortunately, a number of situations where they get stepped on. That, to be fair, might be more common in a bird that cannot fly and is just more running around the ground. Um, I see quite a lot of bird on bird violence, if you will. So some injuries that happen from other flock members, but also other pets, even outdoor predators. But I think our dogs and cats at home can, certainly be a problem sometimes. Falls, which are especially an issue when there are inappropriate wing trims. Night frights, or during the day where they panic and they begin to thrash around in their cage and whack their face, like this little cockatoo here, or damage a wingtip. And then fractures certainly are something we deal with a fair bit. Might be more likely to occur in female birds that haven't the best nutrition and maybe doing a lot of egg production and have basically weaker bones. So broken blood feathers are an important topic because this is a major point of concern for a lot of people. I get asked this question a lot at the hospital. And there's a lot of things that you'll read and hear to suggest to you that broken blood feathers and the bleeding from them could be very dangerous, and that birds can bleed out easily, things like that. I think that's really overblown. I think that the concern and fear about blood feathers and the risk of bleeding out is really exaggerated. And a lot of people believe that it's a bigger danger than it really is. Um, and that influences the way that they may react or try to handle the situation if a blood feather occurs. So we're going to talk about best ways to handle blood feathers, but I just want everyone to know that bleeding out from a blood feather is really quite unlikely, actually. Usually, if we're handling it correctly, we're going to be able to mitigate the blood loss and get it to stop pretty quickly. But also, birds are very resistant to blood loss and very resilient to that. So there's a tendency to panic, and I think when we panic is when we don't always handle the situation the best way. So I just want to have everyone rest assured that it's not as a dangerous thing as you might think. So um, I find a lot of times when people are panicking and freaked out, they have the bird in the hand, they're trying to restrain them, they're trying to see where the bleeding's coming from, they're trying to stop it by maybe putting pressure on getting cornstarch or styptic powder in place, which that's a fair thing to do, but I don't always immediately jump to that because by handling them and you're panicking and they're thrashing and fighting you and their blood pressure stays up, and so bleeding may continue where it would otherwise have clotted and stopped on its own. So there is a place for these hemostatic powders. Things like Quick Stop and similar products have a little bit of topical anesthetic in them, the benzocaine, which is intended to try to offset the fact that it does sting realistically, probably a little bit. But another common misconception is that a bleeding blood feather should be pulled out. That's kind of old school stuff, but it's still kind of common knowledge. It is hardly ever necessary to do that. Usually I start by going, is it gonna, if they stay calm, I'm not restraining them, I'm not panicking, I'm just observing. Yes, I seeing some dripping happen, but is it gonna clot and stop on its own? Many times it will, as long as they stay calm. If it won't, that's when I might go, okay, let's see if I can push some styptic powder into the broken end of that feather. And if it's dangling in kind of a painful hangnail situation and it's mobile, maybe I clip the part that's dangling and then push some Quick Stop powder into the shaft of the feather. Sometimes, if they've really had a lot of trouble, it's appropriate for them to come to the clinic and be seen by us and have some pain management put in. But hardly ever do we pull the feathers out. And that is because it is painful. For flight feathers, they're actually anchored on the outer layer or periosteum of the bone. And so when we pull that out, it's very painful, it's very traumatic, and might even cause follicle damage and problems with the feather regrowing later. And so hardly ever is it necessary to do that. And we only do that if it's really, if we're really desperate. And I think Dr. Pilny, you'd probably agree with that approach as well.
I do agree with that approach, although I might admit I might be a little bit more likely to pull a smaller percentage more when somebody comes in and they're describing a lot of blood loss. I mean, they certainly look worse than they are, like you described.
Yeah.
When the feather breaks and the bird flaps their wing and they throw blood all over and it's
Yeah.
all over their feathers, and they definitely look like a crime scene when you see them. And
Yeah.
many of us, myself included, where we've come home and seen blood all over the walls and things like that. You know how scary that can be. But sometimes we're kind of forced to. An owner is really upset. They don't want to risk it going home and bleeding again. You don't want to send them home. And then the pet owner calls you an hour later and says it's bleeding again and it's bled so much already. And no matter how many times you tell them, their perception is it's lost too much blood. And so sometimes in those cases, I make a clinical call to say,
Yeah.
I'd like to not do it as often. I want to do it only as really needed, but sometimes I'm kind of feel a little forced to do it. And, the majority of the time that is going to stop the bleeding. There's no risk of further bleeding and it resolves the problem. But ideally, methods to not have to do that are ideal and a new way of thinking, like you said.
Yeah, and it's mainly the flight feathers that I'm going to avoid that on the most. It is less injurious to pull out a body feather or tail feather. So that comes into the decision making as well. Um, so fractures, of course, this can happen at any age. We're talking about it for the youngsters because they are maybe more accident prone than older birds would be. Probably the most common fractures we see are the lower bone in the leg, kind of they're what we call tibia tarsus. It's kind of like our tibia. There's a lower bone in your leg. And getting stepped on, hitting ceiling fans, getting crunched by a predator, things like that. We'll sometimes see wing fractures too. It can be both the upper bone in the arm, the humerus, or the radius and ulna in the lower part of the wing or arm. And sometimes we see femur fractures in the leg too. So we can see fractures anywhere throughout the skeleton, but probably the most common that we contend with are going to be these tibia tarsal fractures. And in small birds, they can often be managed well with these basically little casts that we make through layers and layers of white tape called an Altman tape splint. And There are some fractures that can be stabilized that way in birds and some that cannot, and require surgical management. And in larger, heavier birds, surgical management and pinning them may be more appropriate. On average, fractures are going to heal between 3 to 6 weeks, but there are definitely variabilities with that. And usually amputation doesn't come into play, but occasionally it does. We just had a case recently at our hospital with a little cockatoo that had an injury from the band ultimately, but there was enough damage to the tissues of the foot that an amputation was necessary in that case. But most of the time, they can be managed without it. Other traumas that we may see, I'd mentioned beak trip fractures and lacerations of the skin near the vent when they land on their butt or land on their chest and over their heel. I feel like toe injuries, sometimes they get entrapped, like this little rose-breasted cockatoo that the nail got pulled off, or what we call degloving. So maybe you get pinched somewhere, but I feel like with the bird-on-bird violence, definitely I see a fair number of flock mates bite each other's toes. Somebody lands on somebody else's cage and is rewarded with a nip to their toe. So those are some of the things that we see a fair amount. This cute picture of this cockatiel on this dog, you see a lot of cute stuff like that. It makes me cringe every time because I know how that can go. I think we should always be vigilant with our pet cats and dogs because when a serious attack happens, I'm almost always told by the client, oh, they've played together for 10 years, it's been fine. It tends to come out of the blue, no one thinks it's going to happen, and those injuries can be especially devastating. But when there's kind of thrashing or crushing injuries that can happen, in particular with dog attacks.
Social media has not helped that issue either.
No. Yeah, it makes me cringe every time. In the same way that people's babies playing in the Rottweiler space and stuff. I'm like, nah. Yeah, but we see like this cockatiel with this beak injury, larger bird attacking smaller birds and biting off beaks. I feel like that's something I've seen many times in practice. And so it's important for us to be mindful of the size differential in birds when they have direct contact with each other. So foreign material ingestion, in the interest of time, we'll scoot through this pretty quickly, but a lot of bad things can happen with foreign material ingestion, but there's lots of different things that they can eat that kind of cause different problems. And when it comes to heavy metal toxicosis, metals that contain lead or zinc, those are kind of the number two heavy metals we see. There are some others as well. And there are situations in which we might have a persistent foreign body, so something that doesn't get passed, but builds up inside the GI tract, and the worst of those being these fabric foreign bodies that especially come from chewing on various fabrics and fleece or polyesters in particular. So, of course, it's more likely to occur in birds that whose movements are not as controlled or supervised. So, fly around the home and chew on various things. That definitely is when that's more likely to occur. But sometimes it's something they've been given. They have a new cage or a new toy, or just new kinds of materials that they haven't seen before, and for some reason or another, they decide to adjust them, which is why we want to observe when we're offering them new things. So this is kind of a list of different things that I have seen. I feel like our little guys, our little cockatiels in particular, really like to get down on the floor and eat little bits of grout from between tiles or fireplace bricks or things like that. And they'll also pick off and eat things from the types of textured perches where it's kind of like sand grains glued onto the perch. I don't like those as well for this reason. And then sometimes they'll really overdo it on a cuttle bone, or they'll overdo it on a mineral block, or those real coarse mineral blocks that have more big grains of things in them. I've known birds to eat a lot of that. So I mentioned about fabric and fibers. In my experience, natural fibers like cotton or sisal rope seem to create obstructive foreign bodies less often than artificial fibers, but that doesn't always apply. You can have problems with cotton. But I hate, and I'm sorry, probably an unpopular opinion, but I hate happy huts. I hate them. I hate them for a lot of different reasons. And people love them for a lot of different reasons. But one of the issues is that they are oftentimes made of this fleece or polyester fabric, which sloughs off very, very fine polyester fibers. But other fabrics can cause that problem too, where these fibers are ingested, maybe even without the bird being aware of it, just by mouthing or chewing the material. And these fibers don't pass through the GI tract and they build up into a wad, and it can take years for that wad to form. So this is something, unfortunately, we see a fair bit. But other kinds of particulate form material, little bits of plastic, or even larger pieces like beads. Some of the bigger problems we have with heavy metal is like costume jewelry or decorative metal items, bedazzled, little jewels on people's clothing, but also like, jewelry right out of your ear. And then also paint and plaster, older home might even have lead paint. So something I've seen a number of times too is they're chewing on an item like this bell, and the clacker gets stuck or penetrates through the tissues in their mouth. Um, uh, and so that's another issue that we sometimes see. But these guys can be very, very sick. They can feel poorly and they're regurgitating or puking. There may be changes in their droppings. And when they have ingested heavy metals, sometimes we see neurologic signs, and also symptoms like drinking a ton of water, but maybe regurgitating it back up, passing a lot of extra urine in their droppings, and a big crop that won't empty, things like that. This is what it can look like when a budgie's been puking, and in particular, other birds too, but they'll puke and then they'll shake their head and they'll fling it all over onto their facial feathers. So that's a clue that I tend to look for, even if regurgitation hasn't been seen. So certainly, we look at the feces carefully under the microscope. We might even find tiny fibers microscopically that give us a clue. We were taking x-rays as well. Some of the challenges we have is not all foreign materials show up clearly like metal, like this x-ray here. Metal is very dense and it sticks out at you. A lot of other materials, let's say plaster, plastic, wood, fabrics, are the same shade of gray as all the organs in the food are, and you cannot pick them out. A lot of times that's when we might reach for a barium study or even endoscopy to help us figure it out. This is just an example of finding some telltale fibers in some poop. This bird was eating one of those welcome mats. So these are natural fibers, but he was eating a whole lot of it, and he was passing some. We had the evidence, but it was also causing a lot of GI upset along the way. So again, here's my little plug about polyester fabrics, happy huts. This is just an image from us doing a barium study, and we have a really big, big stomach and a big, big gizzard here as well. And then once all the barium passed through and we're watching, sorry, let me get rid of the sound. You don't need that. So the barium is trapped on a fabric foreign body that is inside the gizzard. The gizzard makes regular contracting movements like a rock tumbler to grind up food. And this fabric foreign body has trapped the barium, which is why we can see it there. And so in this instance, as we have to, with these fabric foreign bodies, we go in surgically and open, in this case, the gizzard, and remove this cohesive mat of polyester fibers. Sometimes you can't tell what color it used to be, and then we close them up, but this one probably was a green happy hut at some point at some stage. Lead can come from lots of different places. We think about metal, but it can come from other places like paint chips. And even things like, if you can believe it, mini blinds from the 80s have lead in them. I saw a lead poisoning case in a lovebird that was eating these pastel blue 80s mini blinds. So things that you wouldn't expect. And the lead goes throughout the body. Some of it's in the bloodstream, but it gets deposited in lots of different organs. And over time, it even gets stored in the skeleton. We see a lot of neurologic signs, but also anemia, severe GI damage. The diagnosis can be a little challenging because lead can stay in the body even after they have pooped out what originally they ate that had the lead in it. And so we sometimes rely on blood lead analysis and also blood analysis for other heavy metals as well. But we may not always find the evidence on x-rays, either because it's already been pooped out or it was the same, it's material that's the same shade of gray as the other organs and we can't pick it out. Something that I really appreciate Dr. Pilny put the slide in, because it's important to recognize that even if we take an x-ray and we see metal, like you see here, that doesn't tell you what kind of metal it is. You don't know whether it's toxic metal or not. And you also don't necessarily know when it was ingested. So material like this, whether it's little grit stones they might eat naturally or other foreign material, tends to sequester in the gizzard, and it may stay there for years potentially. So if you find something in the gizzard on an x-ray, you don't know for sure, unless you have a good history, that it was ingested recently and that it's therefore relevant. If I have a patient that we took x-rays on it 6 months ago for some other reason, I'll look at that x-ray and go, was it there then? Do I think it's a new development, and do I therefore think that it's relevant? But we have to be careful in over-interpreting x-ray findings. Zinc is another one we see quite a bit. I find that the most common sources of this are various metals, particularly of decorative objects. So like a decorative metal picture frame, but also zinc galvanized hardware, little connecting clips, or galvanized hardware that makes up like the wall of an aviary. If it gets wet, freshly or new galvanized materials, the water interacts with the zinc galvanized coating and turns it into kind of a white powder that you can then wipe off with your fingers, and that's called zinc oxide. And so that's another way that birds can get zinc poisoning. Sometimes we have our larger pet birds and they literally eat a penny, and pennies that are minted after 1982 contain a bunch of zinc. So there's lots of different sources. I had an Amazon parrot that ate an entire tube of zinc oxide diaper rash cream, and that caused some really serious problems. It really hurts a lot of organs, but the GI tract is especially hard hit, and so they can pass feces. This is something that's different than lead, because once they pass it, once they poop it out, it doesn't have toxic effects anymore. It doesn't linger in the body tissues the way that lead does. So this was an example of a little kayik. This was the exact picture frame he was nibbling on, and I think the damage was like kind of over here. A lot of, let's say, costume jewelry and decorative materials contain zinc, and it was causing him to pass urine that had blood in it, or at least hemoglobin in it. So these can be very serious life-threatening issues, and we can treat it. There's a lot of supportive care, pain management that is involved, and also GI protectants to help stop GI bleeding. And if we can, we try to help get this material out. Usually it doesn't come to the point of surgical extraction, or endoscopic extraction, but sometimes. There are medical ways we can do to help get them to pass the material. But especially when it comes to zinc, really any heavy metal, we want it out of the body first and foremost, as soon as we can. Now, as far as the adult bird, it's easier for me to think of problems of old birds and young birds, and harder for me to think of the middle-aged bird. But there are some things that I think are worth discussing. We've done everything we can nutritionally with enrichment, opportunity for exercise, trying to prevent household hazards. And so we're like, well, okay, now we've gone through the hard part of being a youngster. Now, should it just be smooth sailing from here on? That would be great. But I think some two issues that are worth mentioning, that can be an issue throughout the middle part of life, their adult life, are issues with obesity. and everything that comes from that, and also inappropriate reproductive stimulation and activity. My personal opinion is that hand-reared, hand-fed, human-imprinted birds, that have been, we do this for pet birds, that oftentimes that can be problematic ultimately because they almost don't even know they're a bird. They think they're a person. They're very dependent on us for stimulation and interaction, and also may be more apt to pair bond to a human and regard us as a mate. And the ways that we interact with our birds are not intended to be sexually stimulating, but often are. And then that gets us into problems with, hypersexual behavior, a lot of egg laying, things like that. So with obesity, certainly, higher calorie density diets, maybe they're on mostly a seed-based diet, they may be more apt to get overweight, but you eat enough of anything and you can get fat. Calories in, calories out. There's oftentimes not as much exercise as they really need. And they're getting maybe a lot of healthy stuff, but a lot of healthy stuff that adds up to a lot of calories. And I find that, we oftentimes want a diverse diet. We want variety, but we tend to overdo calories and kind of overabundance. And most folks are not even aware that their birds are overweight. They mostly hide it really well under all their feathers, unless they happen to be more of a naked kid. But they might appreciate that they get hot easily, that they get out of breath easily, and that they're kind of more of a perch potato than they were when they were young. And of course, it's a vicious cycle. They're less active, they're just sitting around more, they're doing less, so they're not burning as many calories. They get fatter, all they're really doing is eating, and then it just kind of perpetuates itself. Um, so, what I do a lot of times in my exam is I'm looking for fat stores. They could put fat under their skin. We call that subcutaneous fat. I find they especially like to do that over their abdominal area, a little bit of a beer belly, and also along their flanks, which I like to describe as love handles, but it can really be anywhere. And I find that they're kind of like people in that where they distribute their fat can be somewhat individual. I feel like there's some species, similarities, like within a species, how they deposit fat, but that it can vary from individual to individual. But I'll find that these guys get hot really easily, they get out of breath really easily. And we start to see other problems like earlier arthritis or bumblefoot lesions from extra pressure on their feet. Oftentimes we're able to, sorry for the gruesome pictures, it's just sometimes a way that I can really show where fat can be distributed, like here over the crop area. If I wet down the feathers with alcohol and part them, that's when I can really see the skin, or kind of below the feathers aside for a minute and see the skin. It looks like yellow fat, just kind of like, if you're cooking a chicken or something like that. It's harder when they have fat stores within the body cavity where I cannot pinch an inch, I cannot see it, I cannot feel it. I might be more apt to rely on imaging, x-rays and ultrasound to identify fat within the coelom. And something I've noted is that some species tend to put fat more internally. I feel like that's true of gray parrots. Have you found that to be true, Dr. Pilny?
Yeah, I've also seen that in cockatoos.
Yeah, yeah. So distributed differently. I think one of the best ways we can combat this is to keep weight logs over time. What did they weigh when they were younger and active? And now, oh my gosh, they're up 50 grams or they're up 100 grams. So keeping weight logs is important for multiple reasons, including picking up on weight gain. This is kind of a little cockatiel where he's got some of the flank fat here, which we can see because he has a little bit of some naked areas there. So it's really important for us to be addressing this by cleaning up the diet, so to speak, making sure that we have optimum nutrition, but that we're not providing an overabundance of calories. So I tend to begin by, I catalog everything they're eating and the amounts. Oh, they get about a tablespoon of pasta or what have you. They get a catalog of everything they're eating and then go, where can I carve away extraneous calories that maybe don't even bring a lot to the table nutritionally. It's really important for us to find ways to promote exercise when they're still young adults or middle-aged. And foraging and enrichment and allowing flight is part of that because it enables opportunities for exercise. We have to be careful when we're making diet changes, when we're switching from a seed-based to more reformulated base, or really making any diet changes whatsoever, that we're not inadvertently underfeeding. And so monitoring weight during any changes that are made is important. So, sexual behaviors, again, we don't have time to go into all of these, but people oftentimes have issues with, let's say, really excessive masturbatory activity or aggression or biting, or excessive egg production. Certainly, there can be behavioral problems that come up when birds are they're hitting puberty, and also they are starting to lay eggs, or there's pair bonding with their owner, and they may be more apt to panic and pull all their feathers out when you go on vacation, or things like that. So here's a little gray parrot who's doing some cavity nest seeking behavior. There's a little budgie who's engaging in masturbation. The thing is, these are normal behaviors. These are sexual beings like any other animal. But it's all about balance. Life isn't just about, making out with your owner and masturbating on your toys and things like that. We want to try to teach from the outset, but also through adulthood, teach balance and promote balance in life. And one of the ways we do that is we go, okay, social interaction, of which sexual behavior is just a subset, is only one part of life. Appropriate feather care, sometimes we see things skewed that way in our feather damaging behaviors. But also foraging is a huge, or should be a huge, part of life. And so we want to have a balanced lifestyle. We want to redirect them away from sexual focuses, and more like, nope, let's get some flight, let's get some exercise, let's make sure you're spending a lot of time foraging. The more or the less abundant food is, and the more that they have to actively forage for it, that essentially mimics times of scarcity in the wild, like in the fall and winter when they have to work really hard to forage and they don't literally have the idle time to engage in reproductive behavior and nest building and those kinds of activities. And so we can mimic that in captivity by having them have a job. They got to forage their butts off to get to get enough food. But we also training them different tricks and play and chewing up toys and all of that. We want that in their life, and not just sexual behavior, with the exception of everything else. So most of us are aware of how we want to try to not, be cuddling and petting a lot. I hear a lot of people say, well, as long as you don't touch their back or their rump or their tail or things like that, that you should be fine as far as, fun in the way that we're petting and handling them. That's really, I think, an oversimplification. I mean, it's just as much a problem if they're sitting on your shoulder, which is kind of an intimate zone, and you're scratching their head for 3 hours. Right. That's as much a part of courtship behavior and is sexually stimulating as rubbing them down their back is. So as much as we like to cuddle and hug and pet our birds, it's really important that we maintain as much social or kind of friend zone, arm's length type relationships and interactions as we can. So, we see a lot of reproductive tract disease as they go through their adult lives. Chronic egg laying is a big part of that. And so, and all of the problems that come from that. Yeah, and yeah, I know we are running a little bit long, so I'm going to move past this and get us to talking about geriatric conditions. Really, yes, we see things like cataracts, and less well-functioning kidneys and things like that. But some of I'd say the big three are cardiovascular disease, and atherosclerosis, hardening of the arteries being a big part of that. Cancer in various places. They're just like us. The older they get, the more likely they are to develop various types of cancers. And arthritis, that's a big thing. I think a lack of exercise and being perched potatoes tends to predispose birds to that as well. We find as our birds get older that we may need to adjust their cage setup and their environment so that we can accommodate their limitations and meet their needs. I find that there's a really big difference between what we see in quote real life or in practice as far as ages of different species of birds and what people's expectations are about age. You'll read and hear everywhere, oh, as a whole, parrots lived 80 to 100 years or so. But in reality, there's a lot of species differences, and there's also birds just don't tend, I think those are more the exception than the rule. Um, and so, so some statistics on different species of birds and, their age range. This is those that have passed away and their tissues were sent for analysis to the pathologist, and those that had cardiovascular lesions like hardening of the arteries and heart disease and heart failure, and those that had tumors, and just kind of the frequency that you see in that. My experience with budgies is I have met a 20-year-old budgie, but that was only once. After 8 years of age, and you start seeing some issues in the same birds. The oldest cocktail I ever saw was 32. I think the oldest recorded one is 35. Just this gives you an idea of kind of how old is old for various species. I have seen maybe 2 African greys in their 50s before, and no more than that. And they were really, really old and decrepit. Would you say that's kind of been your experience as far as these age ranges as well, Dr. Pilny?
Yes, I think that's a huge topic in people's expectation and understanding when disease happens. Longevity in captivity, and captivity in and of itself decreases lifespan in some
Yep.
ways. And, sometimes we have to tell people, we see cancer in young patients,
Yeah.
we see organ failure in animals that we think should only happen when they're older. So people will adopt a bird and they say, oh, I just got a macaw, it's going to live 90 years, right? And we as bird vets are kind of thinking, I don't know, I'm afraid we're going to be diagnosing heart failure at 30, so
Right.
lifespan is not what we typically think. And this information is really useful because it really helps us understand lifespan and disease development in captivity.
Yeah, indeed. And so I'd say one of the things I contend with the most as birds get older is cardiovascular disease, and in particular atherosclerosis or hardening of the arteries and heart failure, which oftentimes stems from that. And so in the interest of time, we're not going to delve into this hugely because in a couple of weeks, we're going to be doing a webinar just on cardiovascular disease. So we're going to be expounding on that. But basically, atherosclerosis is a huge issue. And it's kind of like us, they get plaques in their arteries and the walls of the arteries thicken. And what you get is reduced. This is kind of what one of these thickened artery walls look like. And you get reduced blood flow, narrowing of the arteries, and you can basically get things like stroke, even occasionally aneurysm. And also the heart wears out because it has to work harder to pump blood through narrower arteries. And so we see a lot of heart failure stemming from atherosclerosis. It can be really in any of the major arteries. We think of the big arteries coming right off the heart as being most affected, but it can even be some of the smaller arteries. Here's the descending aorta, but even tiny arteries that serve the feather follicles. And you can even see birds that begin to fail to create new feathers. So we're going to move past some of these slides just because we're going to be delving into this deeply in a couple of weeks, on Sunday, I think the 28th. So we'll definitely cover that. But basically in parrots, the blood just doesn't get to its destination as well. It's not like they're throwing a clot like you think about in a stroke in a person regularly. And instead, they're just not getting enough blood flow to their brain or to their other organs or to their extremities. And this is an example of a bird that lost its ability to even grow feathers normally. But stroke can produce a lot of neurologic signs like you see here. It's most prevalent, we know, in gray parrots, very high prevalence in gray parrots and Amazons. We see it a lot in cockatiels too, but I'll tell you that I see it in practice in gray parrots and Amazons, and so start getting into their upper teens and over 20. And I see it a lot in these species as well, even though statistically cockatoos and macaws here on this graph have a lower prevalence. I still see it quite a lot in practice. We do know some of the risk factors and we try to address them. So that's where diet comes in. We're trying to keep these guys from being obese and chronically reproductively active. Reproductively active hens have higher cholesterol levels because they're making egg yolks and they're more predisposed to earlier atherosclerosis. But high cholesterol containing foods we want to avoid. And I think exercise is really, really, really huge. Well, the ones I see with the earliest and worst atherosclerosis are those that have had very high calorie and high fat diets, and a lot of things like cheese and meat and eggs and stuff that have cholesterol in them. Also, those that have been chronically obese and reproductively active females as well. So this is about heart failure. We'll go into this more in a couple of weeks, but we do see quite a lot of congestive heart failure in these guys, which can cause fluid buildup in the lungs or elsewhere in the body. I always counsel people to be really aware as their birds are aging and getting into geriatric age that subtle changes, like they used to play with this one toy and now they don't, or they had this favorite food and now they don't want it. Usually people describe it in general terms as they're slowing down. And I think what we need to remember is that just being old is not, yes, you'll slow down as you get older, but it's maybe because you have a well-hidden underlying condition that needs to be uncovered. So, this is an example of a bird whose aorta coming down here has very advanced plaques that have become mineralized, and that happens when they get really advanced. And so we use X-rays as well as advanced imaging techniques like CT to identify denser arteries, basically hardened arteries. And this is what those kinds of lesions can look like on a CT. So it's difficult to treat these because they're generally not curable conditions. Prevention is a big thing, right? So recognizing risk factors and addressing that, trying to start out right with good exercise and appropriate diets is super important. But when we are presented with patients with these conditions, there are thankfully some treatments that can help a lot. And the earlier we detect it, the better. Which is why I always have people watching for and reporting anything that seems even slightly off about their bird. When they have already developed cardiovascular disease, this is not the time to start exercise, realistically. They may not really be able to handle that, could worsen their condition, they may be more apt to have a stroke. But it's important that instead that we accommodate what their disabilities might be. Lots of different cancers appear in these guys. We don't have time to go through all of them by any means. But I think some of the more common ones we see, or I see in practice anyway, are of the reproductive tract, both in males and females, with cancers of the ovary or testes or of the oviduct or uterus. I feel like I'm always on the lookout for cream gland tumors, which I feel like I see more in budgies and cockatiels than anybody else. And I also feel like I see quite a lot of GI tumors, and I see them most frequently in macaws and Amazons. Have you had a similar impression in practice, Dr. Pilny?
Definitely. I think probably all the Europygial cancers I've seen have been budgies, you know.
Yeah.
And then certainly, reproductive tract cancers, I mean, reproductive diseases in general are a big part of avian medicine.
Yep.
They make up a lot of the presenting concerns that bird owners come to us for. And so it kind of follows suit that they're going to develop cancer of those body systems as well. But
Exactly.
yeah, I think we see a lot of the common ones in certain predisposed breeds, and we see those
Yep.
much more clinically. Yeah.
Yep. And as a bird is older, cancer comes higher on my list of things I'm suspicious about when they are presented to me ill. a lot of the treatment that we're doing is palliative in nature. We're just trying to keep them comfortable. Depending on the type of cancer and its location, there are more advanced methods like radiation or chemotherapy that can be explored. Here in Colorado, that requires us to refer patients to Colorado State University, the veterinary teaching hospital. But there's a lot that can be done. Not everybody chooses to go to those kinds of lengths, and they may be more apt to palliate. But depending on the cancer and its location, we have to consider what those options would be. Arthritis we see really commonly in our older guys, and I feel like I see it most often in the knee. You may not realize it, but your bird's knee is way up here. We see a lot of knee arthritis. I do see, to a lesser extent, hip and the hock joint or the ankle joint here. I also feel like I see a lot in the spine, particularly in the portion of their spine that has relatively more mobility in it than some of the other portions. And I even see it sometimes in the cervical spine as well. Has that been your impression as well, as far as frequent places for arthritis?
Yeah, I agree. I think the knees are probably by far the most common
Yeah.
place that we see it. I think it's easier when we take x-rays or radiographs to identify it there as well.
Yeah.
And I also have seen it as a cause of feather picking and feather destructive behavior, where I've seen these
Yeah.
older birds start focally picking over these areas, and suddenly they take all the feathers out of their leg, and then you radiograph them, and they have terrible degeneration of that joint. And when we treat
Yeah.
that, they'll stop. So sometimes it's one of the million clues to feather picking, but obviously
Yeah.
we know pain can be that, but sometimes in older birds, arthritic pain is a drive for that.
Yeah, and the same can be said for atherosclerosis. So I've had cases where, let's say, they're plucking only one half of their breast, and they didn't start doing that until they were 25 or 30. And we may find through diagnostics that the arteries on this side are clogged. So I do think that blood flow issues and maybe sensations of numbness or tingling or pain to the region that doesn't get enough blood flow can also sometimes drive some of these behaviors. So now, obviously, just like people, if they've been overweight, that's another reason we don't want them to be obese for their adult years. If they've been overweight for a long time, they're more likely to have to develop osteoarthritis and earlier in life. If they already have some deformities that cause them to bear weight in a weird way or put pressure on their joints in an abnormal way, they're going to be predisposed as well. Um, and sometimes people are noticing that they're again slowing down, they're less active, they're not moving around as much, squatting more low on the perch, and also having their feet more placed close together on the perch, and when they're walking with these little short steps are some of the signs that I look for with arthritis, particularly knee arthritis. um, but sometimes these guys, I do find that they're overweight. I'm kind of paying attention to their posture, how they move. Sometimes I can feel that they have big knobby knees, like old arthritic finger joints you think about, and you can actually feel that. And they may be more likely to shift their weight to their good side. And if they have a bumblefoot lesion, it may actually be on the good leg that they're putting more weight onto. And again, another thing I always watch for is that if they can't reach their lower regions, like under their belly and around their vent, and the feathers are still in their sheaths, that is indicative to me that there's reduced mobility and maybe range of motion. They can't reach them. So we rely on x-rays and CT very often if we cannot really tell much on a physical exam. But this is an example of what kind of normal knees look like on an x-ray. And this is how they can get where they have all these basically bone spurs here. And these are very crunchy knees. They are painful. They have reduced range of motion. And you might see those guys squatting low on the perch or even choosing to lay down on their sternum if they have an opportunity. So probably one of the most important things we do is accommodate these guys. We want enclosures and the spaces that they're spending time in to be appropriate to their mobility limitations. We want to set them up for success and prevent falls. Some supplemental heat can be helpful in these guys. If they're overweight, we want to try to address that. And pain management is really important. I tend to reach for NSAIDs or anti-inflammatories like meloxicam quite a bit, but sometimes we even use opiates, and sometimes we use gabapentin or even a combination of those. And I know you guys have laser capability at the Arizona clinics, or Dr. Pilny. Is that something that you find useful for arthritis, or for that matter, other trauma injuries?
I think as an adjunct therapy, yes. I
Yeah,
mean,
for
you know,
sure adjuncts. Yeah.
yeah,
Yeah.
so much of what we know is going to be the owner's perception of whether it's helping. And if we have patients with severe pain and we're looking to kind of attack it from different ways, cold laser therapy has been proven to help with inflammation, and it's an option for people.
Yeah. Yeah. And I have reached for glucosamine. I feel like that has helped a number of patients. Sometimes I've been able to get them off NSAIDs if I have them on long-term glucosamine. And then there are a lot of different ways that we can make kind of a handicap enclosure, or an old folks home enclosure, as I like to put it. Yes, we want them to have space, and maybe they've had this huge cage most of their lives, but there's a time in which it may be appropriate for them to move into something smaller with not as high a perch level over the bottom. And so I kind of think of it as, yeah, Gma, she lived in her 3-story home forever and ever, and she doesn't want to leave, but actually it's better if she moves into kind of a small apartment. So having padded bottoms too, and appropriate perching surfaces that are softer and maybe also more grippy, are appropriate. There's even a time and a place for living in kind of like a bin type enclosure or an aquarium type enclosure as well. Platforms are another way that can help these guys too. So I know I ran terribly over time. For those of you who have stayed with us, I really appreciate you doing so. Probably tried to cram in too many things. I want to talk about everything that happens in every single life stage of your parrot, and with some limited success. But I hope this was helpful for you guys and touched on some topics that were informative to you. I think at this point, would be happy to take some questions, and because we've run over time, maybe we can hit some of the more common questions, and then others again we can come back and answer and provide answers later on.
Yeah, that was a lot of really great information. So we have a pretty good variety of questions here about
Hmm.
some of the different topics. I might start with some of our diet related questions
Yep.
first. Let's see. We had one about Tops, the brand Tops, and they were asking your thoughts on that since it is a cold pressed pellet and it doesn't have any corn. Have you had experience with Tops?
I feel like it is less so than some of the other brands. I don't know if I really feel like it has been better. I don't know. Do you have a feeling about that, Dr. Pilney?
Yeah, I wouldn't say better. I think it's a good diet. I don't have any problems with it. I think that, pelleted diets, extruded diets, that whole area, it's almost like breakfast cereals. I mean, it's like a whole entire aisle in the grocery store,
Yeah.
now in the pet store. And, every company makes it, and they're all a little different in their ingredients, a little bit different in their nutritional analysis. And it goes back to my harping on variety. So I don't think any bird should just be on any one pellet.
Yeah.
And so if you want to include tops in your rotation, or you want to keep 2 or 3 pellets, I don't have any problem with that. A diet. People who prefer organic, that's an option. People who want to avoid corn, there's some theory of whether corn is an inflammatory ingredient or not. We've never proven that or shown that in birds. But just the same, I don't have a problem with it. And I think it can be part of a balanced diet.
Yeah, I would agree. I don't think that there's any one pellet that is superior to the others. There's different needs for different birds, different interests from different birds as well. And I think, yeah, variety is the name of the game, for sure. I'm not convinced that corn is like the big bad awful thing. I feel like there's a new big bad awful thing every year or so that we want to avoid. But I think the more variety you have the best of multiple worlds of different components to each pellet.
And Tops makes some seed diets as well. I know there were some questions about
Yes.
premium seed diets and how to include those into a balanced diet. And Tops has some seed diets available that are pretty unique in what they're considering seeds. When we think about sunflower seeds, safflower seeds, we even look at the ingredients of most of the pelleted diets, and they're going to contain a lot of the
Yeah.
typical bird foods. I mean, historically we've talked about how bad a sunflower seed diet is, but sunflower seeds are an ingredient in most pelleted diets. So, we have to think of it that way. But Tops does make some seed diets that offer some interesting variety and different types of what they believe are more nutritional seeds. When people ask about premium diets, I think about Dr. Harvey's seed mixes, though they're quite costly, but I think they're a really good quality seed diet. If you want to spend the money per pound for what they cost,
Yeah.
you get what you pay for. You are what you eat type of thing. Lefever's diets, I think most people are familiar with Nutriberries and AV cakes. Lefever wants us to, understand their premium seeds and premium quality. Seeds are what you make them, germinating, sprouting, fresh seeds, that type of thing is going to improve that. But there are several brands out there that make premium quality seed mixes. There are people who make their own. They go to the bulk food and aisle in Whole Foods and they look for some of these seeds and they make some of these mixes, or they add them. Zupreme makes a seed pellet mix. That also, so there are a lot of options there, but those are some of the main ones that come to mind when we think about including them as part of a balanced diet, when we think about enrichment as well.
We might grab some of those brands from you, and then when we're sending out our email with some of this information, we'd love to include some of those there. Awesome. We had someone ask a question about cheese and your thoughts on cheese.
Well, again, like everything in moderation, right? I feel like I'm not so concerned about, they don't have lactase, right? They're not mammals. So the idea is that they can't really digest things with lactose. I personally haven't seen much to suggest that it causes harm, except if it's like really excessive amounts. My main as far as the lactose aspect, my main concern with it is that it's high calorie density, fat, cholesterol. I think little tiny bits here and there for training or treats, I think is okay. Again, everything in moderation, but I don't think birds should be eating cheese, or for that matter, egg every day.
Yeah, it's along the lines of what you said. Most people aren't aware that they don't digest it, so they don't absorb it, so it doesn't have much nutrients. That being said, birds love cheese, they love dairy, they love yogurt. It seems to be something they seek out. I think we're pretty sure too that they don't digest it enough to absorb calcium from it. And so sometimes people will say, oh, I give my bird extra calcium, I give him yogurt every day, or I give him a little bit of cheese. And I don't think we should ever rely on a non-digestible food as a source of calcium either. But I agree with Dr. Fitzgerald. It appears to be harmless. If you feed too much, you're going to have a mess, and with them not digesting it. But it's harmless, and a little bit here and there, especially if you say they love it and it's part of a bond. I'm sure it's fine for them to have a little. They're just not getting much from it. They're pooping it out.
Yeah, I had one case with a cockatoo that it ate tons of cheese, just tons of cheese every day, and it was just pooping out undigested fat.
Yeah.
In its droppings. But that's the only example I can think of. It was like that. It was extreme.
And we've also heard that there are certain cheeses that have less lactose in them. Like a harder cheese has less lactose than like a mozzarella that has a higher, and so some are easier to digest than others.
That's a good point. Yeah.
Yeah, but we do have a lot of birds that will seek out dairy products, so we occasionally will use them here as like a vehicle for medication administration.
Yes.
If you have a bird that really, really likes cheese, sometimes you can put it in with that and it makes it easier to administer.
I mean, they're all still dairy products. They're all still milk-based and they still don't have lactase. So again, I think it's safe. I think when you use it, I mean, cheese is a vehicle for a lot of animals to give medication, birds, dogs, cats, so why not? It's going to be harmless to them. It's just don't feed a lot.
Yeah.
All righty. Well, moving on a little bit from diet, we had a really interesting question that was talking about the health benefits of near infrared light and infrared light to birds and the caution of LED visible spectrum lights at night. They say there's lots of information coming out for humans and all animals / insect species on the necessity of full spectrum light including invisible, NIR, and infrared light. So I know we have a lot of clients that will ask us if they should provide some sort of like UVB or UVA lighting in their homes, especially in like the winter time, when their birds are not able to go outside. So could you guys talk a little bit about that?
I don't know if Dr.
Yeah,
Fitzgerald will agree, but my answer is yes.
yeah,
If you ask me if
yeah.
they should, a bird living indoors that doesn't get outside, that is only near a window, in my opinion, full spectrum lighting should be part of a home care plan. Whether it's full spectrum lighting in the room they're in, whether you want to put a dome over them. I think a lot of the specifics of full spectrum lighting and what we're going to learn are going to have to do with proximity and duration. So I think if it's too close to them, it's a problem. And I think if it's on too much, it's a problem. They don't need it on all day, every day for many, many hours. And we certainly don't want them getting too close to it. But the simplest answer is I do personally believe a balanced lifestyle for a pet bird living indoors would be the addition of some form of full spectrum lighting.
Yeah, I would agree. It's something I admittedly do not think about and focus on as much as perhaps I should. Probably because, I mean, we do see problems, especially in our older birds, related to not having access to full spectrum light, in particular, like osteoporosis, which as we've been doing more CT imaging and avian medicine, we're coming to recognize more and more. Um, but I think it's like the squeaky wheel gets the grease, so to speak. And I feel like, I see many birds really seem to do fine without it. And so there's this assumption of like, well, if it ain't broke, don't fix it. Then they don't really need it. And there's also some species differences. There are some limitations to the research that exists. There's lots of differences of opinion about it. Um, I think it's something I should probably give more thought and time in discussing and recommending with owners, because as Dr. Pilny said, I think that supplementing that's important. As far as other types of light, I mean, it's true like with fluorescent lights, and I'm not sure, but LED maybe they're able to see kind of a strobe effect. We don't really appreciate that, and so. Yeah, but there's a lot on that topic, and I may not be able to fully address all the details of that question, but I think in short that spending time outdoors, not just like through a window, we know that filters out a lot of the spectrum of light, but being outside in a protected environment that has access to full sunlight is optimum, and in times where that's not possible, having UV light is probably a good idea, or full spectrum, I should say.
When we've had questions about that, we've always directed our clients to speak with a veterinarian about it, just because I know some of the things that can come up with excessive use of those lights is damage to the eyes and things like that. So definitely something to talk to their vet about. But really good in places like this where it's so cold that sometimes they're not getting out for
Yeah.
long periods of time.
Yeah.
Well, we talked a lot about sedentary birds and overweight birds, and so we had a question that was asking, do we have any exercise recommendations besides enrichment for birds that are unable to fly?
Mm-hmm. Yeah, absolutely. I mean, I think that a lot can be done with them actually kind of exploring on the ground and foraging on the ground and going from one side of the room to the other, even maybe up and down stairs as well. I think that, and those that don't fly well maybe could still be taught to flap their wings. I think what's important is any exercise that's chosen is not coercive, if we can help it, that it's a behavior that they volunteer and that they choose to engage in for positive reinforcement, rather than, for example, like dropping your hand and making them flap or things like that, or like not chasing them around, but basically kind of just really enforcing exercise more, I think should be avoided. But yeah, as far as birds on a flat surface, having them, I like to like do play too, where I roll a ball and they go get it, or they show interest in it, and I reinforce that and praise them and make a big deal out of it. And then or they like to throw things off a counter, and then those kinds of play activities, even doesn't require flying. And also just having a large cage environment or a lot of places to climb, even if they can't fly. They have ropes, they have hammocks, they have trees, where they can climb all around from one end of the room to the other to access a food cache. Or something like that. But I think a lot of walking around is good, and going up and down stairs is a good way to provide exercise for a bird that can't or won't fly.
And a lot of birds will already climb up and down their cage, so take
Yep.
advantage of that. Sometimes people are successful putting a pine nut on the ground and the bird has to climb down the ladder, the cage, climb down, then they'll pretty much pick it up and climb back up the cage
Yep.
to eat
Right.
it.
To eat it. Yeah.
So like a shell, a nut in the shell, those type of things make them work for it. People have made rope ladders so that the birds can climb up those, things that have a little bit less resistance. There's a lot of things you can do to encourage it. As Dr. Fitzgerald said, walking and movement around the home. If they can't fly, walking is going to really be the next type of exercise a bird can get. And
Yeah.
so encouraging them to do that, those birds that are going to look for you when you go in another room, and then when they find you, maybe there is a piece of cheese there for them, something that rewards them, but gets them to really move around and think about, people say, oh, I do flapping exercises, where you drop your hand. It's
Yeah.
a little bit of something. Most people don't realize they maybe do that for 30 seconds when they think they've done it a half an hour. But just the same, anything that's movement, anything that's activity, anything that helps in the cage. And you can get really creative with this. You can force them to climb on ropes hanging from the ceiling and just get really out there with anything that gets them to move around. There's a lot of ways to be creative and a lot of ways to get them to get out and get some movement.
Yeah, I have two older macaws that don't really flap their wings a lot, but one of the things that I've gotten them is bathing. That's like the one time I can really get them to flap their wings and really move their bodies. So yeah, it's very dependent on the bird and kind of what you can get them to participate in, but a lot of really good ideas there. We had a handful of questions that were about kind of older birds.
Mhm.
Let's see. We had one. As far as osteoarthritis management, do you find any relief with acupuncture? I'm not trained in it, but have seen great results with my mammalian patients. This was from Dr. Madrigal.
Yeah, I am aware of some practitioners that are trained in that, doing it on birds to good effect. I've heard some good things about it. I think one challenge is that, it's the minority of veterinarians are bird vets, and the minority of bird vets have that skill set and that additional training. I unfortunately do not. But I do think that it is worthwhile if a veterinarian that's trained in acupuncture is willing to work on birds. I've known some that did mammals, and they did similar nerve points and stuff on birds, that it was kind of it could be extrapolated over to birds, and there seemed to be some good responses to that. I think the difficulty is finding someone who's trained in that is willing to work with birds.
I agree. I wouldn't rule it out. I mean, I personally believe in acupuncture. I mean, I use it myself and I've seen it do great things for other animals. But I think, as Dr. Fitzgerald said, there are unique challenges in placing needles in a bird, that are a
Right.
little bit different than when that yellow lab sits there and doesn't mind you doing it. It does present some unique challenges. That being said, I've heard people who say they've had success with it and believe it has helped. But I think acupuncture also becomes adjunct therapy as well. And I think so often when we're doing a lot of things, it can kind of cloud what worked and what didn't. But
Yeah,
when it
yeah.
comes to pain control, I think that's where acupuncture has a definite use. And if you could find somebody trained and certified and knows how to do it and can work with birds and the bird will tolerate it, it could be something you try, especially in those birds that medication may not be controlling them, or there's a thought that they're in too much pain more than we want them in, and we're doing everything else. It's definitely not something to rule out. It's just going to be a challenge finding somebody that can do it.
Yeah.
On AAV, is that somewhere where people might be able to find a veterinarian that was certified in acupuncture or had experience with acupuncture?
They'd have to go to the Chi Institute, CHI. The Chi Institute is a main organization that trains. The other one is IVIS, International Veterinary Acupuncture Society. So those are the two organizations that are most known for training and certification programs. So if you Googled either of those, IVIS or the Chi Institute, that would probably be a starting point to find licensed certified acupuncturists in an area that might work on pets. And they might be willing to work on pets other than birds too, if somebody had an interest in that.
Yeah.
Yeah, I'm not certain that the AAV website, that you
No.
can definitely find an avian veterinarian that way, but I don't expect that they would list that specialty unless the AAV member veterinarian specifically mentions it in their information that they supply. And you could probably look there. I just don't know if that would be the best place to look. I think Dr. Pilny's suggestions might be more helpful.
And we can provide links for that as well once we have that, in case we do have any clients that are interested in researching that a little bit more. In a similar vein of kind of older kiddos, we had a question about what happens if you try to modify a cage to make it more accommodating for old age and they don't like it or would prefer their cage without modification, and just some of the best ways to transition to that modified cage.
I think it's a good question. I mean, I think that it's going to take any change like that is going to take some getting used to. My experience has been that they tend to get used to it pretty well. Like it can take some time, but they do come to accept it. I think too, making small changes at a time. Like maybe we change up some of the perches first, but nothing else. Or maybe we keep everything the same except that, and we use your existing cage, but we use a piece of cardboard to create a false floor or a false ceiling that reduces some of the vertical space and length they could fall in their existing cage. So I think making small modifications at a time, and also desensitizing them to new objects, like they've never seen a platform before, and it would be really off-putting for all of a sudden for that to appear in their environment. And so desensitizing them to that, where the platform's across the room and they can see it, but it's not concerning to them, it's not close to them. And then gradually, this is true for any new perch too, any new toy, gradually moving it across the room and kind of keeping within their comfort level and not bringing it any closer than they seem comfortable with the kind of alarmed body language. So desensitizing them to new objects instead of just immediately installing them, and also counter conditioning. So pairing that new thing with something positive, like here's some safflower seed or some cheese sprinkled on this little platform if you want to come check it out. So small changes at a time, and as much as possible, utilizing and just making alterations to the existing enclosure.
We're really running with the cheese thing here.
Yeah, we are.
Look at all the unknown benefits of cheese in keeping pet birds. But just to add a comment to that, the suggestions that Dr. Fitzgerald mentioned in the lecture and what we talk about in this area, as geriatric pet medicine is kind of becoming its own science, and that applies to all pets, including birds, these changes and recommendations are born out of necessity. I mean, these are changes that we know these birds need, and that will definitely positively impact their quality of life. And I feel like if they need them, they adapt to them. I rarely have a bird that won't learn to start using a platform because they can't grip a perch anymore, or they're not willing to accept some of these. It's almost like they understand the limitations they have, and sometimes they're showing those limitations already, and all we do is meet their needs. So if the bird is resistant to these changes, maybe they don't need them. They're still doing fine. If they don't want, different type of modifications, if they can still climb around, if they can still do everything they need to do, it's my feeling to let them decide. Because when it gets to the point that they can't, they're probably going to self-limit and sort of regulate themselves in some way. And they're really going to learn. And I've kept and had a lot of small birds, passerines, finches, and canaries. And a lot of times they live a lot longer. And we see some geriatric changes. And it's almost like you put a platform in there and the next day, even the other ones that don't have problems are standing on it or sitting on it, or they like it. So they'll adapt to it if they need it. And if it's offering them pain relief and these are necessary changes, I think most birds will adapt to it. But if they're resistant, then back off for a little while and modify in time.
Awesome. Well, I think we have time for probably one more question. And this one is one that I would like more information on. We have a lot of senior birds here that are vision impaired,
Mhm.
cataracts and things like that. So we had someone ask if you would recommend cataract surgery for a senior bird that they have. And yeah, we've also considered that for many of our flock members here. So we'd love to hear a little bit more about that.
Yeah, I mean, my feeling, I don't know if you feel differently, Dr. Pilny, but my feeling about cataract surgery is that in most cases, I don't feel like it's really necessary in order for birds with visual impairment to have a good quality of life. There are some challenges to it as far as finding a veterinary ophthalmologist capable of performing that procedure that is willing to work on a bird. Usually it's going to happen in conjunction with the primary avian veterinarian, like assisting with anesthesia and things like that. Also, some birds really aren't big enough for that, right? So like our birds that are, let's say, medium-sized parrots, Amazons, gray parrots, and larger, it is possible. It can be done. There's certainly risks of complications with it. Any surgical procedure where they're anesthetized and you have an older patient, there's some inherent anesthetic and surgical risks of infection, things like that should be weighed with it. I know one individual who had a gray parrot who had cataract surgery years ago, and perhaps due to some basically complications of that, increased pressure in the eye and inflammation in the eye, that eye actually bothers the bird and the cataract eye doesn't. The reason I say I don't think it's necessary most of the time is they're incredibly adaptable to visual impairment. Their ability to basically memorize where everything is in their cage or in their larger environment, and to rely on their other senses. I just don't find that my patients with cataracts and visual limitations really seem to be suffering from it. I mean, I feel like if they have an appropriate enclosure, you don't make unexpected changes, things like that, that then like running into something or falling or something just doesn't seem to be a major issue. And also they can still, have a lot of enrichment, utilize enrichment by feel, social engagement through, auditory stimuli. So I just feel like blind birds as a whole acclimate to it really well, and they have really good qualities of life. And so my personal opinion is that I'm not convinced that cataract surgery is worth the risk and the cost. What do you think, Dr. Pilny?
It's an area too where I think I'm on the fence and there's a bit of a gray zone. On one hand, I would answer by saying some of what you said, and I happen to have an ophthalmologist near me who is excellent with birds and will work on them, and has very, very high success rates doing it. As a matter of fact, one of my associates just had it done in her pet chicken. She had the cataracts removed and feels like it was a great thing for this bird. Now that's a
Okay.
ground dwelling backyard pet, that kind of thing. So, but she's glad she did it, and it believes that it has improved the bird's quality of life and things went well. So I think number one, you have to have a competent ophthalmologist comfortable with birds and able to do the surgery. Two, like Dr. Fitzgerald said, we're going to see them in older patients typically. So we want to make sure that patient has no increased risk of anesthesia and surgery and all that. Minimize that as much as we can. Make sure there's no comorbidities in that patient, because it really does come down to being somewhat elective, and you have to play
Yeah.
the odds when you're doing something elective. The confusion for me also is what you said. Most of these birds, the cataracts have a fairly slow onset, and I think the birds adapt to it really well
Yeah.
over time. We sometimes see an early cataract not mature for years, and I think the birds really adapt to progressive vision loss, and they get to a point where they do really well. I
Yeah.
happen to have a blind pigeon that I've had now going on 14 years, is completely blind, who's actually developing cataracts now, but he was blind for other reasons. And it does not impair his quality of life at all. It requires special work on my part in caring for a blind animal, just like it would for any other pet or blind bird. But I think it really depends. If there was a health risk, a health issue associated with it, that might increase it. But cataracts don't tend to be associated with health issues. I mean, you hear anecdotal things, but they're not associated, shouldn't be associated with like glaucomas and things like that. So I
Right.
think it is an elective procedure. It's up to the individual. It's making sure it's safe, making sure a competent person can do it. There's an old avian textbook that we studied that came out in the 90s that has this diagram showing like a veterinarian like cutting open the cornea and kind of fishing out the cataract, and it's not at all like that. And I think that's a little bit scary, but just the same, ophthalmologists do it as a very routine procedure, just like in people. I mean, a person getting cataract surgery should be a routine, uncomplicated issue, but 1% of people will. And that's just a fact. So I think it really depends. I mean, if the bird's quality of life is not really impaired, it's an individual choice, but it has to include a competent ophthalmologist to do it. I would never even try it. It would have to be an
No.
ophthalmologist with the right
Yeah.
equipment, the right microscope, the surgical equipment, the ability to do the fragmentation and kind of vacuum all the lens pieces out and
Yeah.
all of that. So I think it really is a personal decision on the individual and whether we think it's going to dramatically impair their quality of life.
Yeah, and the other thing too is my understanding, correct me if I'm wrong, but my understanding is that the procedure involves the removal of the old lens, but not replacement with an artificial lens,
Correct. Not in
like in a
birds.
person.
Right. Not
Right,
in
not in
birds.
birds. So, maybe you're going to have light getting to your retina again, but probably you don't have acute vision. You probably can't focus super well, I think would be true.
Correct. You don't
I think,
you remove that fogged up window, but you don't replace it with clear glass, basically.
cor-
So yeah,
correct.
you're not going to
Yeah,
have visual acuity. You have better vision. You're going to see things a little better. They'll be,
yeah,
having worked with birds that have had it, they're more likely to see a hand coming towards them. They'll notice things, especially in bright light and even in
yeah,
dull light, but they're not going to have visual acuity. You're not restoring
right.
that like you would in a person or a dog.
Yeah, and I think it's important for people to understand that that it isn't that you're restoring the vision of the young bird. You're just taking away the clouded glass.
All right. Well, that was a lot of really incredible information. Thank you again so much for joining us today. We have a number of questions here that we didn't have time to answer today, but there's some really interesting things in here. So for everyone that is watching, we are going to be sending these questions off to Dr. Fitz and Dr. Pilny for them to answer afterwards. And then we will be sending those questions and responses in an email, so keep an eye out for that if you didn't have that answer today. And we will also be sending out a recording of our webinar today, and it'll be on our YouTube channel. So if you wanted to review anything that we went over today, or had to hop out at any point, that'll be posted for you to view. But all right, well, thank you guys so much. This was so fun. We really loved having you. And yeah, any final thoughts here?
I just really appreciate everyone attending and sticking with us for the longer webinar. Thank you.
Same here. We appreciate an audience when people are interested in learning. We're all here with the same goal, and I think that every one of these is whether it feels like baby steps or not, is a march in the right direction. And I think we're all really committed, and we want to see the benefits of what we do, and we want to see a hugely improved welfare state for pet birds. So take care and thank you.
Yes, thank you. All right, everyone, we're signing out for today.
Thanks, everyone.
Bye.
Bye.
All right.